So it is not going to take much time because it is she told like it's back to back because it's relevant for this. So I'm just giving a disclaimer. This is not to support any of the industry partner here. I'm just going to strike a closer. So I'm going to strike a discussion with you all because when we discuss about manual and automatic or computerized, there's a general consensus that only manual is good, only because there's error with the. So I'm going to give my point of view because I have been struggling with the manual and now I've been more comfort with a computerized way because it is more easy to diagnose, it is more easy to extract data, and I'm not bothered about any of the external factors. Put my point here. So this thing is very common, basic pre-analysis. You see the reflection, the appearance, the viscosity, the pH, the measuring Semen volume, handling the. But one thing most required is you need to handle the whole sample within a hood. And this is a manual because microscope, and again it depends upon the cost of the lab. I have seen many labs, they telling it is a reference level biological lab, that is a biochemical lab. But still they are doing a analysis. They won't be able to invest more in these kind of equipments. They might even use a cover slip, they might use a new chamber, but what is standardized fusion, macro chamber is much more standardized. And again coming with the discussion microscope, I'm not a master in this book. I'm going to skip this because this is what the main struggle which I felt. And I need to train my own andrology and technicians. So this was my own challenge. And a good andrology technician can be very comfortable in an IVF setup or a bigger labs where there is a more amount of case volume and you will be able to higher cost. So we need a good quality samples with only with the good quality technicians or a embryologist. So these kind of things can happen in a good fertility center or a big sample labs. So if you are not in either of that, if you are a busy clinician, how to strike a balance now? Big question for me. And more common things. For example, if a staff is not in a good mood, you alert them. So basic comes because when it comes to a Semen analysis, everything matters. Everything matters because when I tell my staff, before doing Semen analysis, please remove all the prejudice in your life. Whatever your father told, your friends told, because this is what the one which you give is going to dictate me to the prescription, and it might dictate his future progeny. So please be very careful. Don't take it for granted. Don't any calls. Don't, because many labs what they do, they keep the sample for liquefaction. They run the automatic samplers, then they come back and they do that. So this shouldn't happen with this. And of course, we have this intra-observed errors or the variability also. And staff issues, we always have one staff, one good working staff. We put everything on them because she's good working. She runs the whole lab. She takes care of everything. So that is how a very upcoming center can handle with a possibility of a survival. And again, attrition. When you train a person, for example, you will be giving X amount of money. You will train them. Now what they are there? Now they are a trained technician. Now a good lab, they can hire them. So your training period is wasted now. So whether to train them or not, if you want to hire a trained person, it is costly. If you train them, it will become much more costlier because your efforts has been wasted now. So how to take a balance now? And when a new staff comes, she has to orient it. So these are all things which are, there is many times there will be a skipping of SOPs. One Semen sample comes at 8 p.m. You will be in the practice. What will happen now? Will you tell the patient to go again? Patient is there, I've come all the way there. I'm going to catch my flight in 3 days. But your staff is overwhelmed now. What she will do? She will tell liquefaction is normal. Something she will do, and this can happen. So how to overcome it? So my suggestion would be automation of anything, because we have multiple automatic analysis. We have an AI paradigm. We diagnose cancer with AI. Ophthalmology, they do beautiful things with AI. What we are going to see is only cells. We are diagnosing, we are treating with AI. Why can't we see cells? We analyze cells with AI. this is my state, and I'm going to present the data what I have. This is very easily extractable because once you have a computerized thing, it is easy to extract. I'm not going to go into that. What I'm trying to say is percentiles. You can't say that if the person is having 15 million is normal. So now then you have to go and tell what is normal. Then I will be drawing the graph to the patient. This is called as normal. You are falling this category. You are falling in the 5th percentile. So what is the probability of getting a child when you are in this 5th percentile? And for you to get a natural pregnancy, you have to go to 95th percentile. So whether if you are in 5th, how can I push you there? So these kind of things I was able to explain to the patients. So I can see the whole data, motility, the morphology, how much velocity. So which we analyzed, and we have seen the semen liquefaction trend also over here. So this is raw data. I'm just trying to show things that with automation, with computerized thing, research is possible. How it is possible when you're going to give a drug, you won't see the effect. How will standardize the assessment now? Only with automation, you will be able to standardize assessment. So this is my claim. I want to hear from a senior pathologist here and a urologist here. Just want to take discussion, sir. So please share your views. Even I will be learn and they will be learn, sir. This is my question.
Yeah, that's a real fact. What you have presented just now. We do have problems when it comes to manual testing for semen analysis. It is a real boost after this automation which has come in. But still, I would call it not entirely automated, because we do have to have a pathologist to look into the morphology of the sperms and the motility also in certain conditions, in certain areas where the automated report you think may not be better. You can have a look at the morphology as well as the motility. So it's a combination of both automated as well as a pathologist view of the slides and the sperms.
How much percentage is that, sir? To confirm with the pathologist, is it more? Is it less?
It's 100% in my lab because we make sure, because it's NABL accredited, and we make sure that we have a look at this morphology of all the cases of semen analysis. We don't rely on the technicians, no.
So for upcoming lab, how to suggestion? Or anyone who is busy in practice who want to give some justice to the patients?
I would suggest the clinicians themselves or the embryologists to get trained in looking at the morphology. Don't rely on the technicians.
That's very practical way. Yes.
So I would suggest the clinician to be trained in both the things. That would be the better option, rather depending on the technician. But again, the CAS or automatization, they have few cons compared to manual testing. But at the end of the day, the manual testing is the gold standard.
Accept it, sir. I want to have one more point here because we all know what is gold standard. It's true. But for example, when a clinician is upcoming, he will train himself. When he is busy, it is very impractical for us to go back to the lab and see. Because and if you are running your own center, multiple things will be in your mind. Where this is impractical for us to go. Because there will be the patients there. If anything happens, the prescriptions. So that is also what. So I want to say that.
So definitely in such scenarios, automation is a better option.
Yeah. So I say manual is always the gold standard. There is no way to overcome that. But in case before shifting to a complete manual, we can think about automation. And when it comes to clinical trials, how do you see is it manual or automation?
Manual.
But how will we be able to standardize the clinical trial? Multi-centric trials, analysis.
That's again difficult. I mean, we need a trained embryologist or a proper pathologist for that.
No, if you go to a multi-centric trial, how we can do that? Yeah, X drug is there, we want to test for semen improvement.
I I think, looking at the morphology is the key of the sperms. And looking at the morphology, you don't have to look at those samples instantly. You can prepare the slide, do the staining, and leave it out. Later on, you can always have a look at it
Okay.
by the pathologist.
That is only doing that.
Yes. So it's a hybrid. Do the automated system for analysis of semen, and for morphology, you make a staining by the technician.
Very nice.
It's basically a perpendicular staining, which is a standard technology, standard technique. So they can do the staining and leave it out for the pathologist to view the slides at any time.
Or we can send the samples to higher lab also.
Yeah, you can.
That is a very nice decision because then now we have an actual hybrid here.
Yeah.
Where we can use automation and as Sir says that, say, experience, automation has a poor correlation with the morphology.
Yes.
So, thank you sir.
Right.
Thanks for the time.
Thank you so much, Dr. Natesh, for the very interactive session. I now request our chairpersons, Dr. P.K. Rath and Dr. Raghavir Karni, to felicitate our speaker. And I request the speaker to felicitate our chairperson.